As one of its primary missions, the Maine Health Management Coalition Foundation publicly reports on the quality of Maine healthcare providers. A pivotal role in that process is the Pathways to Excellence initiative. Since 2002, steering committees that include physicians, nurses, employers, quality and safety experts, and health plans have worked together to create and guide this important program. The steering committee recommends which national quality measurements appear comprehensive and fair enough to apply to Maine providers. When no national or state programs seem to be a logical choice, PTE-specific criteria and reporting processes are designed. This includes defining which performance levels fall into the categories of low, good, better, and best. Committee input is also sought regarding how these ratings should be explained to the public. The committees are also seen as a vehicle to explain the range of thinking behind the development of PTE quality metrics, as well as deliver a broader perspective of healthcare improvement efforts and ideas in both America and in other countries. Both the physician and systems committees have structured their challenges using implementation timelines. Each potential new measurement area has to pass through 4 distinct steps before finally emerging into public reporting, accompanied by the potential to become an influential part of a Maine employer's tiered health benefit program. A proposed metric is first examined at a high level for at least a couple of months to determine its general viability. That is followed by the selection of detailed measurement specifications and evaluation criteria. Those parameters are then applied to the available data, and potential performance level cut points are established. The final step before being released to the public is to circulate the final rating assignments given to all providers. This allows time to resolve any potential questions on the specific ratings given to a practice, a hospital, or a system of care. The top of the timeline highlights windows of opportunity to meet and discuss the issues together, as well as remind the committees of the quarterly update cycle for the Get Better Maine website. At PTE meetings, participation falls into 3 categories: simply listen to new ideas, provide review and direction, or vote for endorsement so a new measurement area can move to the next stage of development. The PTE meeting agendas themselves are structured to reflect what is evolving at each of the 4 process steps. Advanced planning for a PTE meeting begins at least a month prior to the actual event. A new agenda is developed based on the timelines and a review of the minutes and impressions from the previous meeting. At least one more review is conducted before materials are distributed 2 weeks prior via email, as well as placed on the member website. Any additions or changes are included in an email sent out 72 hours before the meeting. If at all possible, the goal is to follow up with participants and generate the meeting minutes within a week. The meetings themselves are unique opportunities to present information and exchange points of view in a structured setting. By its very nature, a coalition needs to create a balanced perspective where all the stakeholders have the opportunity to voice their understanding of the opportunities and challenges. At another level, these meetings provide windows for informal discussions and the potential to develop a greater sense of community. Because of the geographical distances separating the various regions of Maine, there are ongoing efforts to make remote participation in PTE committee meetings a more productive experience. Technology options are being examined to ensure that audio and video feeds deliver the required levels of quality. Access to data and its subsequent analysis is at the heart of all PTE initiatives. Every measurement area has the potential to require its own update and review cycle. Data process maps have been created to help ensure the level of quality and consistency demanded by public reporting. Physicians, specialists, and hospitals all have their own distinct processes and data flows. Presentations and discussions of PTE initiatives are not limited to PTE committee meetings. Other foundation-related activities provide additional opportunities to engage new and existing stakeholders. The MEHMC.org member website is a distribution point for PTE-related explanations and resources. There are 2 separate locations where PTE information is available. The first location is the PTE tab on the website's top menu bar. There are 8 categories of information. The Download PTE Materials option connects to administrative details regarding existing PTE reporting areas. The second location is found under the Member Resource main menu tab. The Resource and Document Library contains a folder for 3 separate PTE subject areas. The materials are a combination of PTE committee resources and related reference subject matter. There are other opportunities to better integrate PTE issues into the larger fabric of healthcare improvement efforts in Maine. Within MHMC, events itself, such as staff retreats and staff meetings, provide a forum for coordination of efforts. The potential exists to underscore PTE goals and progress within the expanding community of data members at training sessions and user group meetings. Gatherings such as the Executive Summit, the Annual Symposium, special speaker events, and monthly member activation meetings could all include PTE-related messaging. All of these PTE challenges and opportunities present the need for a regularly updated strategic plan that addresses the interests of all the stakeholders and ongoing projects and programs within Maine and at the national level. PTE initiatives have impact. Their results have the potential to influence individuals and families making important healthcare decisions. It is a process that requires continuous review and improvement in order to earn the trust of consumers, employers, and providers. It is open to the participation of everyone. Please get involved.